A stroke can seem like a sudden event, but did you know that the body provides subtle warnings in the days or even weeks before it happens? Some of these signs are easy to miss or associate with something else, but recognizing them can be vital for survival. In the United States, someone suffers a stroke every 40 seconds, while a stroke-related death occurs every 3 minutes and 14 seconds, according to experts from the Centers for Disease Control. Experts have determined that your body can signal a stroke at least a month in advance, though these warning signs are frequently overlooked. Today on Good Cup of Health, we will explore 10 warning signs of a looming stroke that people often miss, according to experts. These warning signs can either happen individually over time or simultaneously, as your body tries to warn you about a looming stroke. Let's jump right in. Number 10. Severe and frequent headaches. While headaches are common, intense ones that occur suddenly, without a clear cause, could indicate a potential issue with the brain receiving adequate blood flow. Distinct from migraines, this can be a significant stroke sign that should not be ignored. I should point out that you could be experiencing a migraine, but if you typically don't get migraines, it could be a warning sign of a stroke. "It was the worst headache I've ever had," explained a woman who would end up having a stroke a few days later. She further explained her headache and eventual stroke was the result of cerebral venous sinus thrombosis, CVST, a rare condition that primarily affects women under 50. During an interview with thehealthy.com, neurologist Dr. Ralph Sacco from the University of Miami warned, "Migraine headaches can masquerade as a stroke because they have the same neurological symptoms." He further explained, "I tell people to treat it like a stroke and call for help. Let us figure it out." Research studies show that people who experience migraines with auras regularly have an increased risk of stroke. Number 9. Dizziness or balance loss. Another telling sign of compromised blood supply to certain areas of the brain includes feelings of dizziness and trouble keeping balance. If you experience frequent vertigo episodes or feel disoriented and it seems to have come out of nowhere, it is essential to seek medical help. Number 8. Sudden vision problems. Sudden changes in your vision, including blurriness or double vision, are another potential signal that parts of your brain are not receiving sufficient oxygen, as blocked blood vessels can reduce the oxygen supply to one or both eyes. Many people might dismiss these symptoms as a normal part of exhaustion or aging, but they can be a sign of a more serious condition. Experiencing sudden bouts of double vision in one or both eyes may also be a stroke sign. During an interview with thehealthy.com, neurologist Dr. Carolyn Brockington of the Mount Sinai Stroke Center in New York cautioned, "Seeing two images is very unusual for just being tired or reading too much." Dr. Brockington explained how some patients before having a stroke described a painless loss of vision in one eye, followed by a shade coming down slowly over their eye. And then, after a few minutes, slowly the shade goes back up, and then they can see very well. Number 7. Weakness or numbness on one side. Waking up with a numb arm or leg is typically due to a pinched nerve, a common occurrence that usually resolves quickly. But if you experience tingling or weakness in your face, arm, or leg, particularly when it affects just one side of your body, it is a known stroke symptom of insufficient blood flow to the brain or a mini-stroke. Dr. Sacco cautioned that if your arm is suddenly numb or weak and it doesn't go away in minutes, call 911. This was a symptom experienced by a 24-year-old woman who suffered a massive stroke 2 days after giving birth. She was fortunate enough to survive and tell her story. Cardiologist Dr. Nicole Weinberg highlighted that strokes for women in their 20s and 30s are more common than we realize, with pregnancy being the risk factor. Number 6. Speech issues. Sudden problems with speaking or understanding speech can be a warning sign of a transient ischemic attack, TIA, more commonly referred to as a mini-stroke. These disruptions in verbal function are potential signals of a temporary disruption of blood flow to the brain. Dr. Sacco warned that some people might not recognize slurred speech as a potential stroke sign if they take certain medications. He explained, "Some medicines, like painkillers, can cause slurred speech, and people often chalk up speech issues to their drugs as opposed to stroke. But if you've taken painkillers before and that side effect isn't something you experience, you may be having a stroke symptom and need to get help as soon as possible." Number 5. Sudden memory lapses and confusion. Memory and concentration issues, as well as sudden confusion, should be considered red flags. While these symptoms are sometimes assumed to be due to age or fatigue, they might indicate that specific brain functions are being temporarily impacted. Dr. Brockington cautioned, You might struggle to think of a word every once in a while, but there shouldn't be a long period of time when you can't think of anything to say or be unable to speak. If suddenly, out of nowhere, a person experiences confusion or has difficulty understanding others, this could be a sign of a stroke symptom, according to the Centers for Disease Control. People who are experiencing this may not even be aware they're doing it, so it's important for those around them to take notice and get help as soon as possible. If you are still watching, thank you. If you find the information in the video helpful, please share the video so it could reach your family and friends and potentially help save lives. Number 4. Excessive fatigue without due reason. Everyone gets tired, with some feeling exhausted more than others, but experiencing frequent, unexplainable levels of fatigue could indicate that your brain is under duress. Diminished blood flow can lead to a general sense of fatigue and weakness before more severe stroke symptoms show up. If you're experiencing this, call your doctor or visit an urgent care center as soon as possible. Number 3. Sudden difficulty with walking. If coordinating your steps becomes challenging, or you find yourself dragging a leg, your brain is not properly communicating with your muscles, which is an early neurological warning sign of an impending stroke. Dr. Brockington stated that some people may confuse sudden balance issues from an oncoming stroke with wobbliness from alcohol. People think they're having balance issues because they had a drink, but see if that makes sense. She further elaborated, "You won't have delayed balance problems, so a drink from earlier in the day probably isn't to blame. It could be from a decrease in blood flow to the brain. If you notice you're stumbling or having a hard time walking straight or experience sudden dizziness that doesn't go away, call 911 as this may be a stroke symptom." Number 2. Temporary hearing or vision loss. Sudden vision loss in one eye or sudden issues hearing on one side are serious warning signs that should not be ignored. These can be caused by a temporary blockage in the arteries that lead to the brain and are indicative of a potentially serious condition with a stroke risk. Number 1. Heartbeat irregularities. An irregular or racing heartbeat doesn't always correlate to a sign of a stroke symptom, but it can increase the risk of blood clots making their way to your brain. If your heart rhythm is irregular or you are experiencing heart palpitations, it could lead to problems with your brain shortly after, according to medical experts from medicalnewstoday.com. If you are experiencing heart palpitations, irregular or a racing heartbeat, and you don't typically experience these, go to the emergency room as soon as possible. So there we have it. These are the 10 warning signs our body produces if a stroke is about to occur. I want to quickly mention that in rare cases, it's possible for someone not to experience any of the 10 stroke symptoms mentioned in this video. This is one of the reasons why it becomes even more imperative for adults to know the FAST acronym for stroke symptoms. I'll provide links in the video description and describe it in the comments section. So now that we have a better understanding of the signals your body gives you days or weeks before a stroke, let's look at the common risk factors for strokes, according to experts.